And what kind of mental things they carry with them? What do they carry?
So that's what I tried to show. Everybody is animatic, everybody is doing different things.
Okay.
But when somebody is seeing this image, what they get is what I wanted to get.
Right.
That's what I wanted to show to the interested audience.
Let's before we get back to this a bit more, let's go to the second one. This is a work that is done by Sharmila. It's a paint work. Sharmila, can you tell us what this is and what you had in mind when you did this?
Yeah, I definitely had something in my mind when I did that, because that shows about, it's a very explicit image of somebody running behind one's mind. So here I've used the deer as a symbol to address the issues that may or may not be there behind which that person is running. So it could be thoughts and feelings and fears and emotions, which all crop from those fear or apprehensions and all these things. So the deer symbolizes all that, and there are loops around the head. So that fear or apprehension or worry or anxiety that keeps coming back to that person, no matter how many times they go over it again and again and again. Maybe their mind refuses to give up on that process, even though they try to put it down. So this particular work I observed very closely in a couple of our family members and friends. So they went through a period of time when they were going through this repeated looping of fear and apprehensions and worries and anxieties. So later, which I realized that it was actually a disorder that they were suffering. So I thought, let me just bring it to the open, more into the open, because many times it is trivialized. So that was the thought behind why I did this artwork, to address the aspect of anxiety disorders that we see in people.
What kind of painting is this?
This is actually acrylic on paper and some amount of gel pen on it. And it's that.
Excellent. So you have one more work, I think, in this area. Let's go to number 3.
Stop you there, because we heard a little bit of this previous painting yesterday.
Yeah.
And Sharmila actually talked about one of the experiences which brought her some of these thoughts, which is she painted it. This was about a family member who was having a problem with finding things which were dirty or infected, etc.
Right.
So could you just, without naming anybody, could you just?
I saw the family member struggle with the aspect of the confidence that she had about doing things right. It could be in the kitchen, it could be anywhere else, and not being able to do it perfectly the way it should be. So even a small thing like leaving some utensil with some food open for about 2 minutes would set her thinking that something might have fallen, like a lizard or something might have fallen in it, and so she cannot feed it to the others. So she would just discard the lunches or dinners that could, that was one of the very small things that we had observed. Of course, there was a loss of weight and, the emotions running a little high and low and things like that. But all of it, I was coming from this thought that it was not good enough. Whatever she made, she feared giving it to people, because a little bit of this that way would worry her too much.
That's a very, very nice illustration, because we'll come back to that, because I think that will be a good peg to start our discussion on.
Right. Yeah, I think we'll get back to that as we move to the next discussions on that. But okay, so and this one, Sharmila, is tell us a bit more about this. This is about depression, I understand.
Yeah, these were the one. This was probably one of the first works I did when we started off on this theme of mentality, which had a part of it as mental illnesses. So I always attribute the mind to have the capacity to regenerate itself, no matter how many times it gets bruised or scarred. There is a section of it which is ready to regenerate, just like the fall and greenery that comes in the tree and they shed the leaves. So I kind of paralleled it with the way depression may not be the chronic ones, but the small bouts of depression that come and go, like the seasonal things that affect these trees, and they kind of shed the leaves, and then those leaves will never come back. But then newer leaves can come back if you give the opportunity for the tree to regenerate.
Do the same work.
So this is probably, I would say, a hopeful work on the aspect of depression, that if it is picked up early and given the proper treatment and support from the family and friends, they might be able to get over it faster without much intervention or without much damage caused to their persona.
That's wonderful. Let's get some perspectives on that and some expert perspectives on that. I'd like to introduce Dr. Vivek Benegal. Dr. Benegal is a professor of psychiatry and he is the head of the Center for Addiction here at NIMHANS. Several decades of experience with various mental related illnesses, but also specializes on the addiction part of it. So we will be talking to him a lot more about that as well in the second half of this session. But Dr. Benegal, anxiety, depression, two sides of the same coin, or how does this?
Well, they're fellow travelers. They travel together quite a lot. But again, I'd like to go back to the paintings a little bit, and especially your photograph of people. Although you talked about the movement that was happening, for me, looking at your photograph, it was about people traveling, being together, but being alone.
Yes.
And that is the crux of people having mental illnesses, because most mental illnesses leave you alone in the middle of middle of crowds, and that is probably one of the most difficult things of living with mental illness, dealing with mental illness, dealing with people who have mental illness. And so, in that sense, this is a very stark reminder of some of the difficulties that people with mental illness face.
Yeah, I mean, you can pretty much see almost all of them are in their own world.
Yeah.
They are not, except one or two people who are observing around, but otherwise they're all in their own space in some ways.
It could be looking away.
Yeah, so nobody's actually making eye contact. But then this is also very symptomatic of modern living, where nobody's making contact any longer, other than with their phones.
Yeah,
or through their phones.
True.
So there is no phone actually.
There is.
One lady
There's one lady there.
Others don't have, but
Yeah.
still they're not looking into anyone.
But so what about these two? What anxiety and how is that different from depression?
Yes. So I think one of the things to talk about, because anxiety and depression are so common, and you can't be human without having been anxious or having been sad.
I mean, just 10 minutes ago, this thing wouldn't come up, so we were anxious.
Yeah. So we really need to be able to make a break, or rather a decision between what is pathological, what is an illness, and what is part of the normal spectrum of being human, of human emotions. And like I said, when the anxiety or the depression, they become so severe that it causes distress to the person or to people around, or it is unremitting that there is or when this is causing the person to become incapable of taking care of their day-to-day functioning, etc. That's when it becomes pathology. That's when it becomes a illness. So, in a sense, all mental illness are actually shades away. It's like your shade card. It's just shades away from normal behavior. It's at one level in real life. It is just a quantitative deviation from what is normal behavior. Until it becomes so severe or it becomes so frequent, etc. When one talks about anxiety and depression, psychiatric disorders related to anxiety and depression are the most common disorders which afflict human beings.
How common?
They're very common. I mean, we just 2016 we did the National Mental Health Survey of India, where we surveyed the prevalence of mental illnesses in India. And what we found was above 5% of people had these common mental disorders, which are that's about 70 million Indians. That's quite a lot. That's more than the population of some European countries.
Absolutely, yeah. And that could not be comprehensive still.
It's not comprehensive because we only looked at some of these disorders, which we'll talk about.
Right.
But the scary part is 86% of had not received any help, had not sought treatment. So
Did they know?
So that's the worst part.
Yeah.
That most people suffer in silence because they do not have a name to give their affliction, and other people don't recognize it. Most of the time, affliction is met with, "Don't worry, this will go away. Cheer up. Buck up, things will get better." Right? And this is of no help. But you can't blame anybody because neither the seer nor the person who's experiencing really knows what they're going through. And so it's important.
So let me meet Dr. Himani Kashyap. Dr. Kashyap is the Associate Professor, Clinical Psychology. So she is a neuropsychologist and works out of NIMHANS and has been doing a lot of work with patients and clinical work with patients in this area. The depression, does it always have triggers?
Not often, actually, and so that's one of the really difficult parts of it, because I was looking at the photograph of the 10 people, like Vivek was saying, about 5% in India may have depression or anxiety. But I think worldwide the figures are much more, about 15 to 30%. So perhaps it's underreported in India. But if you look at that, there are 10 people in that picture, I just counted. So that means that about 3 of them might actually be depressed or anxious. And often the triggers are not very obvious. So sometimes it could be because of a loss.
Loss or a love, or disappointment.
A loss of a loved one through death, or the ending of a relationship, a breakup, a divorce, that sort of thing. A loss of a child, for instance. A loss of a job, a move to a different city, lack of social support. So these can be triggers. But often the expectation of for many people with depression is, or the things that they're told is, what's wrong with you? Nothing's happened to you.
Really?
Cheer up.
Really? Life is good, you're doing good, you have a job, you're doing this. Yeah. So why should you be depressed?
Yeah, and that's really unfortunate. And so I think we need to recognize that depression is often quite silent, and that it can be because of long-standing genetic, personality, as well as brain underlying, which is well. So it's very difficult to pinpoint exactly what went wrong.
Yeah. So you can be going along, trudging along smoothly, and then suddenly you just can be depressed without any triggers whatsoever. And is that usually something that people will come out of, or does it more often than not require external help?
Again, like Dr. Vivek was saying, I think depression is quite self-limiting often, that an episode can actually remit by itself as well. But in that time, a person is likely to go through a lot of difficulty carrying out their usual everyday functions as an individual, as a member of the family, as a member of the society, at work, etc. So maybe it can get better, but often it doesn't. It can, turn into something that's a little more protracted, or another thing that can be an eventuality is suicide, which we'll probably talk about a little later.
But let's get a little bit granular.
Yeah.
See, when we talk of depression, depression is a wide brush. We really need to realize that there are different kinds of the most common kind is where you have fluctuating. What is depression? Depression is sadness. Sadness, which is accompanied by other things, lack of motivation to do things, unable to do your day-to-day functioning. It affects your appetite, it affects your sleep. You're not able to sleep, or you sleep excessively, or you have no appetite, you eat excessively. Things like
motivation.
Lack of interest. It's lack of sexual interest, lack of interest in working, and all these negative thoughts. Negative thoughts about self, negative thoughts about the future, negative thoughts that one will ever come out of it. However, this often happens in two broad contexts. One is what earlier used to be called neurotic depression, but is now called dysthymia. But basically, it is long-lasting, usually lasts for more than 2 to 3 years, of fluctuating depression. So the depression goes up, down. You're able to, say, watch a movie and feel happy, somebody cracks a joke, you're able to feel happy, but you go back to your depressive state. The other, and this is most often triggered off by loss, etc.
Okay.
And so this is more reactive in that sense, like you were asking.
Okay.
The second major type of depression is an episodic depression. It has a beginning, a middle, and an end. Usually lasts for say 6 to 9 months, but can anything upwards of 2 weeks onwards. But generally around 6 to. This is with mild, moderate, severe depression, but this is more organic.
Okay.
It occurs because of perturbations which occur in the brain. Often can happen without any trigger, can be triggered off, but persist beyond the trigger. And these are more sensitive to medication, etc.
Okay.
The first kind are more sensitive to actually psychotherapy, sitting, working on strategies, changing the way one does things, all that. I mean, both work in both situations, but they're slightly different.
Right. So what you're saying is, if it is effective for medication of the second kind, then those are definitely some chemical imbalances that medication tries to correct.
Yeah. Yeah. In fact, let me go back to your picture of those drive branches. For me, they represent the new science of depression, where we are able to actually show that there are changes which occur in the networks, the brain networks. And net, what happens to the networks is actually they're losing their leads, they're losing their connections, they're losing the insulation of the wiring in the brain. And this is happening. So both of these are actually physical things. Okay. I mean, earlier we had this whole mind-body dichotomy that the mind is different from the brain, etc. It resides somewhere else in the some other ionosphere.
Right.
But we do now know that the brain creates its own mind. And a lot of and I would say actually almost all of these psychiatric disorders and our feelings of happiness, sadness, etc. are created here. And so I find your painting so prescient of what really goes on in the brain. In fact, we didn't talk about it yesterday when we were preparing. So this shocked me out of my things that, hey, we should talk about this.
I don't know, I'm going to put some questions for you.
Yeah. So it's good to actually underline a point.
Yeah.
When people get very worried when we talk about physical treatments, pharmacological treatments, saying that, oh, this must be much more severe, this must be really bad that you're asking me to take medication. No. What psychotherapy does, medications do, they change those. They change. Both of these equally change those. It's, there was, I forget who this was. There was a premier of China, Deng Xiaoping, who said, I don't care whether it's a black cat or a white cat,
right?
As long as
it's a cat and mice, yeah.
So, this is, I think, something that we need to establish.
Right.
I don't care whether it's psychotherapy or whether it's pharmacotherapy or medicine. Yes. As long as it changes.
Yeah. We discussed that with Dr. Shobha as well last time when we did that, whether you needed allopathic or homeopathy or other things. He says it doesn't matter, but some things you got to look out for.
Yeah.
As long as that is in place, then if whatever helps.
And let me press this point a little further, because we now find, for example, taking omega fatty acids regenerates your brain, helps depression. We now find that exercise or yoga it does the same things as some of the medicines.
Right.
I mean, the evidence for these things are upcoming. I won't really be able to swear that yoga by itself will take care of your depression, but it is certainly a very useful thing to have in addition to the medication. So the days of this versus that, allopath versus homeopath, are long gone. And we should also, climb up on the ropes.
And in fact, I would also add that there's a lot of research, that there's a lot of research evidence now on what happens in the brain before and after taking medication, before and after taking psychotherapy. And it looks like the same kind of things happen in the brain.
Okay.
They're similar across disorders, across depression and anxiety. They're similar
regardless of what kind of medication or what kind of psychotherapy is used.
Right.
So that's another point as well. That
And,
seems
and,
like the
and
things that
I'm
work.
very proud to say, it's a very love demands, that a lot of that work is being done here.
Yes, yeah. We're absolutely in the right house. That's for sure to talk about these things.
Hari, I have one small question.
Yeah.
So when somebody who's a cheerleader, who's trained thousands of people, he goes through a depression at some point.
Everybody can go through depression. Okay, like everybody can fall down. You can be the biggest bodybuilder in the world. You can fall down and break a knee.
Yeah.
Okay, so nobody is immune. You can be the best person, what shall I say, exercise person in the world and have a heart attack and die. The same way, you can have, of course, with a caveat that the more resilient brains are less likely to develop problems. It's about vulnerability and stress. The greater vulnerability or weakness one has, the lesser stress you require to knock you off. The greater resilience you have, you require greater stress to knock you off.
So the triggers.
So yes, so it's not as if you're saying that, oh, I'm helpless and I'm at the mercy of the elements. No, it's not that. Let's make that clear. There are ways you can protect yourself against these risks. There are ways that you can increase your resilience against mental illness. There are ways that you can teach your children to avoid problems in the future. There are ways that you can teach your children and protect them from developing drug and alcohol problems. And that's got to do with very simple things like parenting, nutrition, teaching children skills, all that. It need not be high-funda things like giving medication,
Right.
rearranging their sense.
So some of the biggest comedians have died of depression, have committed suicide because of depression. So I think there is no real correlation on those things. So let's move to anxiety. Before we come back, I want to talk about what's happening on the research side as well, and what you alluded to. We do know a lot more today than we knew maybe 20, 30, 40 years ago. But we'll talk about that. But let's go to the anxiety part of it. Where do you start to say, okay, this person is really not depressed, he's actually anxious? And the follow-up question I have on that is, for example, something like suicide, is that mainly in the domain of the depressed person, or is there anxiety also that can lead to that? I don't want to go into suicide. We do that a little later, but it's just a follow-up question. Now, so where do you say, okay, now this is anxiety?
So depression and anxiety are slightly different conditions. So like Dr. Vivek said, they're fellow travelers, so they're slightly different from each other. So the core with anxiety disorders is fear. We all have fear, and we mustn't necessarily have fear. We're not going to go and touch a snake or fire or something like that. And we've learned fear, and that helps us survive. But when fear goes overboard is when it's possibly an anxiety disorder. When there is fear of something that's not an immediate concern. So as I'm sitting here, I'm perfectly
what others think is immediate concern.
Objective.
What
most reasonable people would think in the same situation. Whereas with depression, the concern is more about sadness rather than fear, and more sort of guilt, regret, looking back on the past sort of thing. And anxiety is more fear of things that might happen in the future, more likely. So with anxiety disorders as well, there are different kinds of thoughts that people might have. So it could be fear of something specific, like I'm terrified of snakes. So terrified that every time I walk into a room, I'll check all the corners, which is unreasonable, excessive.
Yes.
Right?
Yeah.
Or, for instance, being afraid of talking in public.
Yes, that's quite common. I can't stand to speak.
It's one of the most common fears, actually.
Yeah.
Or speaking to people sort of higher in authority and that sort of thing. So that's what we call social anxiety. So there are different kinds of anxiety disorders. But the core with all of them is mostly fear, which is just sort of gone into overdrive.
Okay.
And it would result in, like we were looking looking at Sharmila's painting about
The OCD.
Yeah, so OCD is about repetitive thoughts of a certain kind, about things not being clean enough, or things being wrong, or things not being done well enough. Sort of concern with perfection, contamination, thoughts which are considered inappropriate, like sexual thoughts or blasphemous thoughts, things like that. But the essence is that the mind is sort of racing and thinking about all of these things that could go wrong potentially. So that seems to be the essence of anxiety disorders.
And that can't be controlled? You can't control the mind from racing away?
No, not when you have these.
Not when you have this. Okay.
So I mean, since you brought up this whole difference between anxiety and depression, somebody many years ago told me a very simple way of telling them apart. One, anxiety is about the future, your worries about the future. And depression is about the regrets about your past.
Oh, nice. That's pity. Yeah.
However, like she's saying, that it's only when these spiral out of control. Control is a major issue in mental illnesses.
Right.
Loss of control. When they spiral out of control, do they become disorders? A, the person is not able to control the anxiety related to thoughts. For example, anxiety disorders can be further subdivided or are further subdivided into generalized anxiety disorder, where there is free-floating anxiety. Something terrible is going to go wrong. I don't know what is going to go wrong, but something terrible is going to go wrong.
Yeah.
Or you have social anxiety that, like you talked about, that in social situations I find, I'm anxious. Or I have phobias, which are about specific fears. I have fear of dogs or snakes, which she talked about. And then there are two other things which are in the anxiety disorder spectrum. You mentioned a little while back that our numbers were a little less in NMHS. These are things that we didn't look at. You said our numbers were a little less, but because we didn't look for, say, something called post-traumatic stress disorder.
Yeah.
That there is a trauma somebody faces, which could be war, which could be violence in childhood,
an accident or rape,
and subsequent recurrent fears about that, recurrent flashbacks of being in that position. And the final one is, of course, obsessive compulsive disorder. The people who work in obsessive compulsive disorders swear that they should not be part of anxiety disorders any longer. Yeah. Because although the major thing is that it causes and evokes anxiety, it's about these recurrent thoughts and impulses and fears which keep coming in insistently into your mind, although you're trying to resist it. And they're often accompanied by things which are called compulsions, which are repetitive things that you have to do to control
yourself. You have to do that.
No, but that is to control the anxiety.
To control it.
Okay. So yes, there is very little control that people have, which is what makes it a disorder. But these have very, very good treatments. And these are things that I think we should, going further, talk about the fact that treatments are available. Because, again, as I repeatedly keep on going at this figure, 86% of people with CMDs had not sought or received treatment. That is a shameful figure.
Really, and certainly I think that's something that we should talk about. What about, I hear a lot when I talk to people, whether it's youngsters, and sometimes we see that in our work environments, about self-esteem, self-worth related things. We see it in our children and their friends and all of those things. Where does that come from? Where does that come from? Is it something that gets acquired at various points, or is it something that happens right from childhood? Where does that come from?
So self-esteem is probably sort of an innate vulnerability, a larger underlying vulnerability for many of these disorders.
Okay.
But that doesn't necessarily mean that all people with low self-esteem necessarily have a psychiatric disorder. Lots of us can function with shaky self-esteem. Sometimes we feel good, sometimes not so much, etc., and we get by.
In public, you feel good, but in private, you're always.
Yeah, so all of us have different sort of shades of that, and we sort of manage, to protect it largely and get by, sort of thing. But self-esteem is about how we see ourselves as largely capable, able to manage things, etc., or not. There can be so many shades of that. But it is something that is underlying, possibly. Again, it's a mix of genetic as well as environmental influences. So genetic and whether it's inherited, most people in my family have low self-esteem, that sort of thing, as well as parenting and schooling, extremely harsh discipline, that sort of thing, that can affect self-esteem. But even things that contribute to resilience. So, my child's self-esteem might be really bad to begin with, but if they find something that they're really good at, that can actually improve self-esteem, that can be the point of resilience, for instance. So there are so many shades to this, so many ways that it affects our day-to-day.
So how does it affect young adults, for example? I know 18, 19, 20, they're getting into their lives, entering the primes of their lives. How debilitating can this be? And when should they recognize that, Doctor said, there are treatments. So when should we, how should we around them or themselves be able to recognize that, this is really a self-esteem issue and I shouldn't be feeling this. And I can take help and I can improve myself. Is that possible?
So self-esteem is often at its shakiest during adolescence, because that's the time that people are trying to figure out what their identity is, what they stand for, what are their values, what are their strengths, what do they find difficult, what is their stable sense of self, as opposed to what varies across situations and that sort of thing. So it is shakiest during adolescence, but that in itself is not an issue. So that's what I want to emphasize, that self-esteem in itself is not a disorder.
Right.
Can't be a disorder.
Yeah. So it's not a disorder. It's just a transition in some sense sometimes.
It's a psychological factor which can be a vulnerability, which can equally be a point of resilience.
Okay.
Can I put that into context a little bit? In fact, let me segue away from what you said.
No, you can.
Yeah. So one of the things that we all grow up with, from the time that we are born, is we develop a set of psychological abilities.
Okay.
And psychological abilities to understand, to think, to react to people's emotions, to various things. There are three major domains of psychological, among a whole lot of others. Because I say three, and I see Himani looking at me saying, but three major ones. One is what we call executive functions, which is basically the functions which help us to start off something and complete it.
Okay.
Right? And it's basically also a set of controls that one has. I start off something and I finish it. Or I am able to hold control over my emotions, etc. The second set of things is emotional regulation, the ability to regulate one's emotions. And the third one, which is very, very important, again, like Himani is saying, these are pertinent through all the psychiatric disorders, is emotional recognition. My ability to recognize the emotions of another, my ability to understand what the other person is thinking, which give rise to empathy, the ability to,
Take perspective,
all that, which is what makes us human. And these are the psychological abilities which we use to function day to day, to deal with the day-to-day challenges that we face, whether they are psychological challenges or physical challenges, etc. And what Himani was referring to a little while back was that during the development, I would say human brain, but of the human mind, there are deviations in the trajectories that occur because of a variety of reasons. And these determine how one deals with one's environment, and therefore often give rise to some of these vulnerabilities, so that when you are faced with stress during childhood, adolescence, or adult life, it gives rise to some of the difficulties that we talk about. And this is where your self-esteem, etc., fit in. Because these are psychological abilities. Some people have some better psychological abilities, some people have slightly weaker psychological abilities. They can be changed through learning. People can be taught to be better. And this is what our education is about. This is what this is why we say that there should be art education in schools.
Right.
This is why we say that we should bring back playgrounds and get children to play.
Sports,
Because
learn to
that's
lose,
where you learn your,
learn to lose.
exactly, that's where you learn your abilities.
Yeah.
And unfortunately, the way our normal life is going, our, the sports ground is your cell phone. So that is obviously leading to worse of abilities in children and adolescents.
Right.
So I don't know whether that gave you a sense of perspective.
Yeah, no, I think that's good. I think, because there is a lot of this talk, but I'm glad to hear that self-esteem in itself is not a mental illness of any sort. And I think that's the first takeaway for anybody who is going through those. And but I guess the other question then would be, how do I get over it?
In fact, Hari, let me just also come back to the fact that even anxiety is not a mental illness.
Okay.
In fact, you need a little bit of anxiety to do things.
Yes.
If you are without anxiety, you're not going to do anything.
Yes.
So it's there's something called Yerkes-Dodson law that we're taught of. That as your anxiety mounts, your performance actually
improves. Yes.
Until it reaches a point where your performance plateaus and then starts falling.
Yeah. Yeah.
So I mean, you need to have some regrets in life.
Yeah.
And of course, now we are becoming philosophical. When we're talking to artists,
yeah.
But also, I think to answer your question, when does it become a problem? It's when we see other symptoms.
Yeah.
So it could be in the form of depression or anxiety.
Yeah. Don't take responsibility for something simply because you don't feel that you are.
Perhaps. So if you present
but then you have to look at severity.
Yeah.
If it is very severe, you have to look at persistence, that it is persisting beyond. And you have to look at disability, that it disables.
Yeah.
And these are three things which actually decide whether it is an illness.
Yeah.
Or it's. So to just give you an example, for instance, supposing I'm walking somewhere, walking to work or something, and I see a friend and I sort of smile and wave or something, but she just walks past me. So I could think, strange that she didn't smile back at me. Oh yeah, maybe she was busy with something, she was preoccupied. Oh yeah, I remember she had an exam, whatever. Versus I could think, my God, she didn't smile at me, she didn't like me. She doesn't like me, I'm not important enough, nobody thinks well of me, I'm useless, I'm a failure, there's no point worth living. So that's possibly what might go on for someone with low self-esteem, compounded by difficulties in multiple other areas, plus maybe ongoing depression. So that's the way someone with low self-esteem with depression might think. As opposed to someone with, largely okay self-esteem, doesn't have depression, etc.
So would that be the time to actually go see you?
Yeah.
And
like Dr. Vivek was saying. No, but like Dr. Vivek was saying, when it's pervasive, when it is persistent, when it is across multiple areas, when it's causing a lot of dysfunction, that everything that happens around me leads to the same conclusion. That, when thinking becomes inflexible, that I can't see it in any other way but that I'm hopeless, I'm useless.
Right.
So if that becomes like a one-track thing, then it's obviously a cause for concern.
And what is, when they do come to you with this, what is the success rate of getting them out of it eventually, and how long usually? I mean, I know these are difficult questions, but I'm just trying to get a sense of, what is the cure?
I wouldn't get bogged down there.
You won't be.
I would rather give the message that for most people, this is an achievable goal.
Achievable. Yeah.
Right?
Great.
There will be difficulties. Some people will have greater difficulties. Some people will find goodness of fit. They will find a therapist that they gel with first time. Some people will require 3 people before they find somebody that they can gel with. So there are a whole lot of things. So to give a number is probably not a good thing.
Not fair.
The message we need to give is that there are effective treatments out there. We need 2 things. One is to talk about it so that more and more people know what these are. Sorry.
Yeah.
We need to talk about it, and we need to have conversations like this so that more and more people know what's out there.
Yeah.
B, people are able to give it a name.
Yeah.
Because that itself is half winning the war. And C, knowing where to go. And having access to it. And that's a little bit of a problem because we are in a place where there are very few practitioners, etc. But it's still there.
Still there. Yeah.
So these are 3 things that I think we really need to focus
and
on.
are these long treatments? I mean, these medications and things for depression, or whether it is for anxiety. And I had one more question. Suppose there's somebody, we're anxious about, you have small cuts and you feel like, oh my God, I'm going to, something's going to happen and my arm's going to fall off or whatever the thing is. Now, that's fairly extreme, I would think, right, of anxiety.
No, can I answer that question? Because
Yeah.
I think it's an important question to answer.
Yeah.
This is something that keeps coming up.
Yeah.
With our